We continue with diagnosis according to pathogenic chi. Let's now talk about internally generated wind. The difference between internally generated and exogenous wind is that internally generated wind arises as a consequence of Zhang-Fu and blood imbalances. Invasions of wind are seen when the body is invaded by exogenous pathogenic qi. This difference is extremely important in relation to treatment strategies and treatment techniques. When there is exogenous wind, you must open to the exterior and expel pathogenic qi. When there is internally generated wind, you must extinguish wind and treat the underlying Zhangfu or blood imbalance. Wind in the body is similar to wind in nature in several ways, and it can be just as destructive. There may be a slight breeze that just manifests with symptoms such as tics or a mild dizziness, or it can be like a hurricane and cause paralysis, spasms, and stroke. This is particularly the case when the wind has resulted from heat. This can have a very destructive and sometimes fatal consequences. One of the major problems with wind is that it can whirl up phlegm and send it up to the head, blocking the orifices. This can result in the person losing their ability to talk and make the tongue stiff. The phlegm can also block the channels and result in paralysis. Some of the disorders in Western medicine that are manifestations of internally generated wind are tetanus, febrile convulsions. Wind can cause gentle movements, such as when a flag flaps gently back and forth on a summer's day. But it can also make the flag stand rigidly in the air, not moving to either side, such as in an autumn storm. In both scenarios, it is characteristic that the flag's movements are involuntary, and this is the same in the body. All the involuntary movements of the muscles and all forms of cramping and spasm will be due to wind. Its etiology will depend on specific imbalances that have led to the generation of internal wind. For the symptoms and signs, symptoms can be mild, such as tremors, tics, numbness, and dizziness, and can be more extreme, such as loss of consciousness, aphasia, extreme vertigo, coma, convulsions, and paralysis. There will also be symptoms of the underlying imbalance. For the treatment principle, we extinguish wind and harmonize the underlying imbalance. In our acupuncture treatment, we may choose from acupuncture points Do20, Do16, UV10, GB20, and Diver3, as well as points to treat the underlying imbalance. Our kneeling technique will depend on whether it is a deficient or an exogenous pattern of imbalance. For further explanation, Do20, Do16, UB10, GB20, and Liver3 all come in extinguished wind. The advice to be given to patients will, to summarize, internally generated wind can be caused by the following patterns of imbalance: invasion of exogenous pathogenic qi, liver fire, ascending liver yang, liver yin deficiency, liver blood deficiency, and in turn, it can result to phlegm wind. Thank you for your attention.